Here to have a quorum. We will have the secretary please take the roll.
Representative Bentley. Here. Representative Bowling.
Present in my annex office.
Thank you. Representative Bray. Representative Birch. Representative Dotson.
Present.
Representative Elliott. Representative Fleming. Here. Representative Frazier. Representative Marzian. Representative Gibbons-Prunty. Representative Rayburn. Representative Raymond. Representative Riley. Representative Sharp.
Here.
Representative Sheldon.
Here.
Representative Tate. Here. Representative Weber. Representative Westrom. Representative Wilner.
Here in my annex office.
Thank you. And Chairman Mosier?
I am here.
We have quorum.
Okay, we have a quorum established and will conduct business. We do have several members coming in and out of this meeting to go to different meetings, so we will do our best to go ahead and get started. We will hear House Resolution 59 first. Just please introduce yourself and proceed. If you have any guests, please have them introduce themselves. I think I see Layla.
Yes, ma'am.
Thank you.
Great. Thank you, Madam Chairwoman and members of the committee. I appreciate the opportunity to present House Resolution 59. And as Representative Mosier stated, I have a guest. So if you would like to introduce yourself.
Yes, hi, good morning. My name is Layla Kaushon. I'm an attorney with the Kentucky Association of Sexual Assault Programs. That's the coalition that the members are your rape crisis centers serving constituents in your districts.
Ms. Layla, for the sake of the time, if you would like to just go ahead and present on this resolution, I would appreciate it.
Absolutely, thank you. So I'm here to speak on behalf of this resolution and asking for everyone's support today. While the resolution covers programs outside of rape crisis centers, including domestic violence shelters and children's advocacy centers, for time purposes, we only had one of us come to represent all three of the coalitions. And the other two coalitions are the Kentucky Coalition Against Domestic Violence and the Children's Advocacy Centers of Kentucky. So please know that our coalitions are a resource for you all on any bills relating to these issues. So Representative Tate is taking an important step with this resolution, and we greatly appreciate her for sponsoring House Resolution 59. We also want to thank the two current co-sponsors, Representative King and Representative Banta. Domestic violence, sexual violence, and child abuse are all public health crises. These are not partisan issues. Rather, they are issues that unify us because we are all impacted by the harms they cause. All of us want to live safe and healthy lives in safe and healthy homes, including children, and no one deserves to be abused or violated. Domestic violence shelters, rape crisis centers, and children's advocacy centers have continued to provide services throughout this pandemic. And when we have 1 in 10 children who are sexually abused before their 18th birthday, when we have 26% of 10th graders who reported sexual victimization have attempted suicide, when almost 29,000 children were involved in reports of family violence in 2019 alone, and each year we still must list and commemorate those lives who were taken by a partner or ex-partner. We need to take a hard look at and really own what's happening. We must center these public health crises with policies that are evidence-based so we can prevent these harms from ever happening. We can't stop until the violence stops. Together, we can make great progress for our Commonwealth. And I thank you all for your time, and we look forward to seeing this list of co-sponsors grow. Thank you.
Thank you very much. And, just as our resolution states, we know that violence, domestic violence, sexual violence, and child abuse each one of us, none of us are limited from that. Every one of us knows someone, either we've been a victim of this ourselves, or our children have been, or our brothers or sisters or our parents or our neighbors. And so I think that it's very important for us to call attention to this, not only the impact to the individual, but the impact to our society and to our communities at large. So I certainly appreciate you coming and testifying for me. And at this time, if there's any questions, we'll open for questions.
Thank you so much. This is an important resolution. Do we have any questions or comments from the committee?
Make a motion on the bill, on the resolution.
We have a motion and a second. Please take the roll. Thank you.
Representative Bentley,
Yes, ma'am.
Representative Bowling,
Yes.
Representative Bray, Representative Birch, Representative Dotson,
Yes.
Representative Elliott, Representative Fleming, Representative Frazier,
Yes.
Representative Marzian, Representative Gibbons-Prunty, Representative Rayborn, Representative Raymond,
Yes.
Representative Riley, Representative Sharp,
Yes.
Representative Sheldon,
Yes.
Representative Tate,
Yes.
Representative Weber, Representative Westrom, Representative Wilner,
Brief explanation, if I may. I just would like to vote yes, first of all, and to thank Representative Tate for this really important resolution. I think we spend so much time and legislative power focused on punishment and not nearly enough on prevention. And I'm really eager to work together on evidence-based programming and initiatives to prevent violence. So thank you very much.
Thank you.
And yes, enthusiastically.
thank you. Chairman Mosier.
Yes.
Wonderful. Thank you.
Okay. All right. Thank you.
Great. Thank you very
House
much.
Resolution 59 passes. Same should pass on the House, and I expect to have more registered votes.
All right, great.
All right.
Thank you very much.
Thank you very much. Okay, next, and the Senate is still on the floor, so we are trying to adjust for anyone available to present bills. We will next hear Senate Bill 154. Representative Frazier will stand in for Senator Tom Buford, and I invite Marie Cole to join you. Just introduce yourselves for the record. Okay, and Kevin too. Welcome, thank you.
My name is Marie Call. I'm an attorney here in town, and I'm a lobbyist with the Kentucky Home Care Association.
Is your microphone on?
Well, no. Marie Call. I'm an attorney here in town, and I'm a lobbyist with the Kentucky Home Care Association.
My name is Kevin Payton. I'm with Top Shelf Lobby, and we represent the Kentucky Academy of Physician Assistants.
I'm Representative Deanna Frazier, District 81 in Madison County. Thank you, Chairwoman and members of the Health Committee. I'm standing in for Senator Buford in support of Senate Bill 154. During the pandemic, home health services have become increasingly utilized as hospitals had to adapt to preserve bed capacity as they cared for COVID-19 patients. According to the Center for Medicaid Services, 1 in 10 patients that are discharged will receive home health. Senate Bill 154 would modernize Kentucky's nursing laws so that advanced practice registered nurses can be reimbursed by health insurance providers for home health services. Senate Bill 154 allows APRNs and also physician assistants to be qualified to be able to prescribe and supervise home health services. This needed change would improve access to important home health services and potentially prevent the need for many hospital and nursing home admissions, all of which are costly to the consumer and the taxpayer. According to the Kentucky Department of Insurance, Senate Bill 154 does not increase costs of health care to the Commonwealth or administrative costs to insurers. And I would appreciate your support.
Okay, thank you very much. Do we have any questions from the committee? And I know that we have one more guest online, Evan Reinhardt. So I don't know if you want to introduce yourself for the record and if you have anything to add.
Thank you. Thank you, Madam Chair. Evan Reinhardt, Executive Director for the Kentucky Home Care Association. Nothing to add. Thanks to Representative Frazier for her support, and would appreciate the committee's support.
Okay, thank you very much. We have one question, Representative Sharp.
Thank you, Madam Chairwoman. How does this affect, or let me ask this, is this solely for home services?
This is to conform. This is to conform Kentucky's law to the federal law for home health services. Yes.
Okay. Thank you.
That's all it does.
Okay, thank you. See no further questions. Secretary, please take the roll.
Representative Bentley? Yes. Representative Bowling?
Yes.
Thank you. Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Yes. Representative Fleming?
Yes.
Representative Frazier?
Yes.
Representative Marzian? Representative Gibbons-Prunty? Representative Rayburn? Representative Raymond?
Yes.
Representative Riley? Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Yes. Representative Weber? Representative Westrom? Representative Wilner? And Chair Mosier.
Yes.
12-0-0.
Okay, good. Senate Bill 154 passes with favorable expression. The same should pass on the House. Thank you very much.
Thank you so much.
Thank you, Chairwoman and members of the committee.
Thank you. Okay, next I see Senator Meredith is here with us. So if you would like to approach the table and you can let us know which bill you'd like to present first. And I don't know if you have any guests, but feel free to introduce anyone you have with you. Thank you.
Thank you, Madam Chair. Appreciate your indulgence. Appreciate us having a Friday afternoon meeting. I know how challenging it is for everyone, but if you don't mind, I'd like to start with Senate Bill 55 first.
That's perfectly fine. Thank you.
All right, thank you. This deals with Medicaid copays, or is known in the healthcare industry as Medicaid no-pays. And I hope the starting point for this is we all understand and appreciate that healthcare is too expensive, way too expensive. You know, we spend 2 to 3 times more than other industrialized nations on healthcare. And one of the primary causes of that is the administrative cost, the billing cost. It's 30 cents of every dollar, which again is double what other industrialized nations pay. And I've had the pleasure of serving many of you on the committee over the last 3 or 4 years. And it certainly has been a learning experience. But when I presented this bill before the Senate, I mentioned that I think every bill that we pass in our committees should have a 3-pronged test, that the bill should make sure that health care is accessible, that it's affordable, and improves the quality of care. Today we're dealing specifically with co-insurance, and you know it's intended. It has 2 purposes. Co-insurance, one is to share financial risk, obviously, with folks. Usually in the commercial market, it's usually 20% of the bill. The second intent is to change behaviors. Using very simply, if you've got a sore throat and you got a choice between going to your family physician or maybe running to ER in the rural communities because it's more convenient, well, you're talking about maybe a $20 bill versus a $200 bill. So probably you're going to default to going to your family physician, which appropriately you should. Problem is that doesn't work for Medicaid patients. It just doesn't. And while those co-insurance amounts are not sizable, they are impactful. And let me share a story with you that I had just a couple of weeks ago. I had a primary care physician in my home community of Grayson County tell me, so I really like Senate Bill 55. I said, well, I appreciate that. I like it too, but why do you like it? He said, well, I had a patient last couple of 3 weeks ago that was a COPD patient, and making the appointment, and my office clerk told the patient there would be a co-insurance. And he stopped and thought. He said, well, maybe I'll wait a week. Now, to us, a dollar seems rather insignificant, but to our Medicaid recipients, it's not so insignificant. And this doctor told me that the patient waited the following week, and unfortunately, their condition had worsened, and they had to be hospitalized. So, additional expense right there. And that's just not an isolated incident. It happens each and every day. Now, the cost to the Medicaid program is about $11 million, but the cabinet has agreed that they can absorb this within their budget without any additional appropriation from our state. You know, this is a policy that truly is penny wise and dollar foolish, because think about that. You can go to a physician, be treated versus being treated in the hospital. And we know we don't have so much money within the Medicaid program. And when we start to run short of those funds, what happens? Usually the providers pay an additional price by reduced reimbursement. So again, this may have been a policy that people think has some value to it, but it really doesn't. Only complaint I've heard about this is I've had some of my colleagues suggest that everyone should have skin in the game. But again, realistically, that doesn't happen. You know, you can force these patients to pay these copays, try to, but the end cost to the provider and to society in total is much greater. Again, $11 million to the Medicaid program that they can absorb, but I can assure you the actual cost of this is in multiples of that by continuing this policy. So with that, Madam Chair, that's my position on this bill, and if there's any questions, I'd certainly entertain them.
Thank you very much, Senator Meredith. I know that we've had several discussions about this, and I've talked to some of my colleagues and your colleagues and the cabinet. The cabinet is fine with this,
yes,
as I understand it, and this will actually increase federal drawdown dollars for Medicaid.
Yes, it will.
It's probably, I think on paper, it looks like $11.7 million for a fiscal note, but there's a state share and a federal share, and it's you know, with that mixture of dollar and the increase in federal drawdown dollars, this is not going to be an $11.7 million fiscal hit to the cabinet, as I understand it.
No, to your point, the portion that belongs to the state is $2.8 million. Right. But again, as you said, because of the drawdown and the multiples of this, then it's significantly less. Mm-hmm. But again, in the total cost of the program, there's a savings here by eliminating this.
Right. Well, and I think this makes sense as well to the providers who have to chase these very small copays. It's really cost prohibitive to continue spending overhead and administrative dollars trying to track down $1 or $2. And to your point earlier, this really is one of the drivers of increasing healthcare costs.
Well, one of the options to the provider is say, no, you've got to pay the bill, and then probably the Medicaid recipient's going to say, well, bill me. Well, you know, the cost to generate a bill for a patient real in excess of $15, $20. You may not think so, but all the people that are involved, it is actually that much. So again, it costs to the system, which again has to be absorbed by everyone else that's not within the Medicaid program. So it's a major driver of cost to the healthcare.
You're exactly right. And as far as folks having skin in the game, there are more creative ways to incentivize folks to participate in their preventative and otherwise health care. So, I agree with this concept and invite any of our committee members who have questions or comments. Okay. All right. Seeing none. I'll entertain a motion. Motion on the bill. And a second. All right. Secretary, please take the roll.
Representative Bentley? Yes. Representative Bowling?
Yes.
Thank you. Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier?
Yes.
Representative Marzian? Representative Gibbons-Prunty? Representative Rayburn? Representative Raymond?
Yes, thank you.
Representative Riley? Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate? Yes. Representative Weber? Representative Westrom? Yes. Representative Wilner? And Chairman Mosier.
Yes, ma'am. Okay, Senate Bill 55 passes with favorable expression. The same should pass on the House. Thank you. And I know that you have another bill, Senate Bill 61.
Yes, Madam Chair, Senate Bill 61. I do have a guest with me that many of you know. She's testified many times before. I'll ask her to come to the table. And I'll allow her to introduce herself for the record.
Thank you.
Good afternoon, members of the committee. Mackenzie Longoria. I'm the Director of Public Policy for the Alzheimer's Association Greater Kentucky and Southern Indiana chapter.
Madam Chair, the genesis of this bill is a Senate concurrent resolution 46 that was passed during the 2019 session with Senator from Henderson, Senator Robbie Mills being its primary sponsor. And it called for establishing Alzheimer Dementia Workforce Assessment Task Force. And tragically, maybe you recall, Senator Mills lost his father months before to this dreaded illness, and his unfortunate firsthand experience has been the guiding force for the work of our task force. And I know several of you participated in that task force as well. I certainly had the honor and privilege of serving on this task force, as did my guest here. And we gathered data and came to the stark realization very quickly that we were ill prepared to handle this disease, and which is growing at an alarming rate. And the lack of preparation is not meant as a criticism of healthcare providers. We know everyone's doing the very best they can to try to deal with this, but it certainly is new territory for us, and presently with no cure. You know, this last year, the COVID-19 virus certainly has got everyone's attention, and we're losing over, I think, 4,500 people this last year. But at the same time, we've lost close to 2,000 people to Alzheimer's and dementia the last year. And what's really alarming is because of the isolation that figures I have seen say that number's increased almost 16% during this period. You know, and nationally, this number is approaching 200,000 people a year. And unlike COVID, there's no vaccine for it. We're still learning about it and how to deal with it. And, you know, it's projected that this is going to increase even more in the future as we have an aging population, the baby boomers, which obviously I fall into that category today. So it's going to grow and grow and grow until we can find a cure, and we all hope and pray for that. And, you know, this number is expected to grow significantly for Kentucky. Right now we have around 71,000 people who have disease, but by 2025 it's projected to be 85,000. And institutionalization of these patients is not the preferred path of treatment. We found out that that's not highly effective, but we want to keep them in their home, their familiar surroundings as possible, as long as we possibly can. The problem is this is placing a tremendous burden on family members. You know, to accomplish this, we've got 272,000 family caregivers in Kentucky, and they provide over 300 million hours of unpaid care. And family caregivers are supplemented and assisted by home health and personal care agencies. They certainly provide an invaluable service to it. But, you know, the United States Bureau of Labor Statistics estimates that 1.1 million new direct care workers will be needed by 2024. And that's a 26% increase from 2014 and with the shortage of personnel to begin with. You know, adding to this problem, and one of the things this bill tries to address, is for home health personal care attendants, turnover in 2020 was 22%. So not as just the shortage of personnel, but the massive turnover in these folks as well. In 2019, this is the last data that's available, personal caregiver, the turnovers exceeded 60%. Instead of just showing that one of the major causes of this is lack of preparation of those personnel. You know, a lot of people have the false impression that when you're providing service to an Alzheimer's patient, you're just providing adult babysitting. And we know it's much more than that. And to be effective in what they do, they need training, and presently that's not mandated. Again, a lot of good folks have taken this seriously. The home health agencies do have a requirement for this, but we think there needs to be some standardization of this across the board, particularly for personal care attendants. So that's why we're asking that we adopt some standardization of the training for this personnel. But there's a second component to this. As this grows, demand for services is going to grow, and we want to make sure that our patients and their family members are protected. I call this the consumer protection portion of it, that if a provider holds himself out as being an Alzheimer's dementia caregiver, they need to ensure the public that their personnel have been trained in this area. So it simply says if you're going to advertise yourself with this, you're going to hold yourself out as this, then you need the training. If not, there's a fine that's associated with it, and appropriately so. So that's the two major components of the bill. But I'll turn this over to Ms. Longoria, and I'm sure that she can give you more information than probably you ever want to know in your lifetime.
Thank you, Senator Meredith. I think that's a compliment. Senator Meredith does a really great job kind of explaining the genesis of the bill and sort of the need for it. He really, talked about some of the numbers, not just of the individuals with this disease and how that is increasing both in Kentucky and across the country, but also the major gaps in the workforce. And so I just very quickly wanted to touch on a few additional points, kind of looking at the why, the need, and, the impact that this would then have. So obviously when we understand the why, I mean, even prior to a pandemic, you had a general proclivity, I think, in this country, both federally and at the state level, of individuals wanting to, age in place. This sort of became this new term in the 2000s, right? So if you look back in the year 2000, there were about 1.5 million people who lived in long-term care facilities, specifically nursing homes. But if you fast forward to 2018, 80% of those age 50 and over say that they want to live at home with help. So I think there's many reasons for that, especially when you have this disease. It's familiarity with your environment and can lead to a lot less behavioral issues. And then on the other side of the coin, we know that the amount of money that is saved by the state whenever you enable someone to stay in their home and community as long and as safely as possible, rather than pushing them into a healthcare system or pushing them into a long-term care facility, those costs are obviously much higher. And in the case of a global pandemic, we need to ensure that we're not overwhelming that healthcare system that we saw was very much overwhelmed. So we have a growing need of individuals living longer, wanting to stay home. And the other issue is these individuals are living longer now with more complex chronic conditions like Alzheimer's and dementia. I think something that's incredibly important, especially here in Kentucky, is if you look at our last round of state data, when we were taking a telephonic survey of individuals 45 and over in the state who indicated some type of cognitive impairment or memory loss that they were experiencing, of those individuals, 94% also had another underlying chronic condition, namely diabetes, heart disease, or COPD. So you have a growing population that has Alzheimer's or another form of dementia in addition to managing these other complex chronic conditions. So it's sort of this confluence of issues that are all coming together now, and really that is falling then on the shoulders of our home health workers, both those medical home health aides as well as those non-medical personal service aides. So the fact of the matter is, unfortunately, the training standards, and this is not unique to our state by any means, the training standards for both the HHAs and the PSAs are unfortunately inadequate. At least for our home health aides, because they are able to be reimbursed by traditional Medicaid services. There are some federal requirements, and Kentucky follows that 75 hours of required training. But when you drill down a bit and look at our actual curriculum that is provided by our fantastic KCTCS system here in the state, unfortunately, cognitive impairment is taught alongside with mental health for a total of 4 hours, which means an individual could be receiving as few as 1 to 2 hours of training on cognitive impairments, and that's not even dementia-specific training. As far as the personal service aides, because their services are not reimbursable by traditional Medicaid, there are no federal requirements whatsoever. And this is where things get a little crazy, is that this is almost a wholly unregulated part of the direct care workforce. It's really up to the discretion of states and employers to decide what type of training they provide for their workers. And as the Senator Meredith mentioned, there are some outstanding personal service providers out there that do great dementia training, but that is completely up to their discretion, and it is not by any means mandated by the state.
Motion on the bill.
Thank you, Madam Chair. I don't have really a question because I cannot thank you enough, Senator, and all your efforts, and as well as Senator Alvarado on taking care and address this particular issue. On the way home last night, I got a call from my father, who's 93. He might as well. He's actually better health mentally and physically than I am. But my mother's 86, and she's not doing well. She's got dementia. She's got multiple problems and issues. And having this type of direct care training can really significantly help our situation out. And I know this is an ongoing and probably increasing issues and problems, and I thank you all taking a lead to jump ahead of the game onto this home health care issues and direct care. It's so important, so important to go through this process to help support families. I've talked to Representative Bentley on several occasions about how we need to help out home health care and support our families. So thank you all very much. Senator Alvarado, you'll be up next, but thank you all very much for all your efforts. And I know Chairwoman has been very instrumental in this area as well, and I can't thank her enough for all her efforts. Thank you, Madam Chair.
Thank you, Representative Fleming. I just want to mention very briefly that there's another element of this that we think is very positive and creates a career ladder for people. And we have a lot of people who start as personal care attendants or maybe nursing home assistants. And with this kind of training and certificate in their portfolio, so to speak, it may spur them to further their education and fill the pipeline for registered nurses, physicians, and so forth. So we think that really is a win-win situation for everyone. But thank you, Madam Chair.
Thank you very much. Thank you for your work on this. This is critical work. We know how important it is to help individuals, older individuals, and those suffering with dementia of any sort to stay in their homes. And we've seen the effects of loneliness and isolation certainly this year more than ever. I think that anytime we can standardize training, improve our training, and put those important family supports in place, it's a win for everyone. I'm actually, and I keep talking about this to my members, I'm actually reading this book right now, Being Mortal, and it's about folks, I think that everyone should read this. It's about how we support individuals in their older years and what we're doing as a society and how we can help people, whether they stay at home or not, function and not have that loss of independence. So I appreciate your work very much. Do we have any other questions? All right. We'll entertain. We do have a motion and a second, I believe. Okay, please take the roll. Thank you.
Representative Bentley? Yes. Representative Bowling?
Yes.
Thank you. Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Yes. Representative Fleming?
Yes.
Representative Frazier?
Briefly explain my vote. I just wanted to thank Senator for bringing this forward. I served as co-chair with Senator Mills, and I hope that this is the first of many objectives that we identified, because it was very eye-opening and quite alarming, not only the need but the lack thereof, and somehow trying to address both of those at the same time. So this is a very good first start. I'm happy to vote yes.
Representative Marzian? Representative Gibbons-Prunty?
Yes.
Representative Rayborn?
Yes.
Representative Raymond?
Yes.
Representative Riley? Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber? Representative Westrom? Representative Wilner?
Yes.
Thank you. Chairman Mosier?
Yes, ma'am. All right. Senate Bill 61 passes with favorable expression. The same should pass on the House. Thank you so much for your work.
Thank you, Madam Chair, and thank you, members of the committee. Appreciate the opportunity to present.
Thank you. Next, we have Senator Alvarado here to discuss Senate Bill 74. Welcome, and I believe your guest is already here. So
that's right.
Just introduce yourselves for the record and please proceed.
Absolutely. Ralph Alvarado, State Senate 28th District. It's good to see you all again here today. Several years ago, and I've told Ms. Longoria this story at an NCSL conference, I heard a presentation regarding dementia services and what states could be doing better for dementia. And working in long-term care, it's obviously very important for me, for the people that I take care of. And so I realized at that time that Kentucky's ranking when it came to the elderly was rather poor. And other states like Wisconsin were doing a really good job, or ranked first or second in addressing a lot of those problems. And I remember the presenter was from Wisconsin asking for some information. They gave me a whole litany of things that they had done as a state to help improve their rankings on it. And since then, we've been looking for ways to improve the care in our ranking as a state. And Senate Bill 74 is another attempt to help us achieve that goal. We know that Kentucky's programs and services are rather fragmented when it comes to the elderly and with dementia care. And this bill establishes a permanent position with the Cabinet by amending KRS 194A-600 to turn the Office of Alzheimer's Disease and Related Disorders to the position of Dementia Services Coordinator. The office has been in existence for 2 decades, but has never been staffed and, frankly, not funded. This bill amends the duties of the position by creating or implementing the Kentucky Alzheimer's and Related Dementia State Plan. It manages the Alzheimer's and Related Dementia Disorders Council. It also assesses dementia-specific data that comes in for the state, evaluates state-funded services. It streamlines applicable government services to increase efficiency and improve the quality of care. It eliminates unnecessary costs by identifying duplicative services that we might have, and also identifies and applies for grant opportunities. It updates the composition of the council by adding a current caregiver. It adds a representative for long-term care industry, a provider of the adult daycare industry, a rep from the home care industry, from a physician advisory group, and from a nurse advisory or advocacy group, rather, from both of those. So the question becomes, why do we need this? And frankly, right now in Kentucky, we lack a lot of coordination when it comes to care for dementia, and that hinders our ability as a state to evaluate the effectiveness of policy efforts. Having a point person, which is what this would create, that can help keep their loved ones at home instead of having to go to a long-term care facility, I think would be crucial. And right now, we have no one in state government who updates our state health plan when it comes to dementia care. And by updating it, we can reduce long-term care impact of the disease and also help improve our budget. So I think we're missing out on millions of federal dollars that could be available. Virginia established a coordinator and brought in over $5 million in federal grants. And 11 other states that all excel at dementia care have established this position in their state governments as well. So I think it's a good start to have somebody coordinate things for us. Again, there's a long way to go. I think we'll be seeing a lot more legislation. I think, as Representative Frazier had mentioned, some work has been done on that task force, a lot of recommendations that we've got to look at as a state that we can gradually kind of help implement to make our care for dementia here in the state and make us one of the top 10 rather than one of the bottom 10. With that, I'll turn it over to Ms. Longoria.
Motion on the bill.
Okay, we have a motion and a second. If you would like to give us a very brief. Okay.
Senator Alvarado, that pretty much covers all of it. I do have one, Representative Moser, you had asked for some information from other states' dementia services coordinator. Mm-hmm. So I was able to reach out to a former colleague of mine in Georgia that now serves as their coordinator, and she was getting some more information about what kind of federal dollars they brought in. They did receive about $300,000 from a BOLD grant, which is actually something the association passed at the federal level. But she did tell me something very interesting is she has actually already done a lot of work to, quote, harness and coordinate numerous already available community and state resources that has enabled us to expand access and improve services without any moving of state funding or requests for the state budget. So I thought that was helpful as well, and kind of showcase one of the things that we're hoping for is that in addition to applying for federal funds to improve our services and supports, this person would be able to really look at what is already available in this state, how can we make it better, and how can we improve upon on it. And I know that Senator Meredith is fond of saying that there is money to be had, it's just a matter of how we're spending it. So I think that's a great example from Georgia. One of the states has implemented this position.
Thank you very much. That is great information, and I look forward to getting this implemented and the position funded, because I think you're right that we will, once we get this really coordinated and some of the provisions or the things that we need in our state to really pull down those federal grants, we're going to see a big difference. So thank you for bringing this. Thank you for working on this. Again, I will pass over my companion bill, but I am very supportive, so thank you. Do we have any questions from the committee? Representative Fleming.
Thank you, Madam Chair. Senator Alvarado, once again, I'm a great admirer of yours, and I think you've always done a fabulous job in the medical community, as well as pushing the policy and pushing the needle further out there. Just more of a curiosity, it's more of my financial background, and I talked to the chairwoman some time ago about this. This is going to be funded, or is this going to be absorbed from a cost standpoint internally? Can you just give me a little better
Sure.
perspective of that? Thank
I
you.
appreciate that. I think it can be absorbed internally. And some have heard, I mean, we've had committee hearings during the interim where I've been a little bit critical. The cabinet's using funds to help advertise Medicaid services, which is about $7 million. And I keep thinking, you know, $150,000 probably would help fund this position. They could take it from that and probably get a lot more long-term benefits putting it into this position than trying to advertise Medicaid when people are easily signing up for Medicaid right now, is what I would argue. We've got a record number ever in the Medicaid system. So I think it can be absorbed. Obviously, they're going to request that we add more into the budget for this at some point in the future. So that's something I'm sure that, you know, to make it safe, I suspect that Ms. Longoria would say, hey, please make it a line appropriation in our budget at some point in the future. So if you want to have it secured for that, absolutely, that's how we have to do it as a General Assembly to direct the cabinet to do it, or we could just say you're going to, out of what you have, you can fund it out of there. I think they have the funds to do it. I think it's money better spent than what they're using it in some other parts of in their budgets. But I think if we want to direct it specifically, we'd have to put it in the future to make sure that they're going to allot it for that. But I think it's a small investment for the amount of grants you could bring in. I mean, it pays for itself time and time again. So that's how I think it could be financed.
Okay. All right. Thank you. I would agree that this is a critical investment in infrastructure that will help move Kentucky forward in this area specifically. Okay, I will entertain a motion.
We already have it.
Oh, we have a motion, a second. That's right. Okay, please take the roll. Thank you.
Representative Bentley? Yes. Representative Bowling?
Yes.
Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming?
Yes.
Representative Frazier?
Yes.
Representative Marzian? Representative Gibbons-Prunty?
Yes.
Representative Rayborn?
Yes.
Representative Raymond?
Yes.
Representative Riley?
Yes.
Representative Sharp?
Yes.
Representative Sheldon?
Yes.
Representative Tate?
Yes.
Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Brief explanation, if I may. I just, it was an enormous privilege to be able to serve on the dementia work group in 2019 with Ms. Longoria and some wonderful legislators. And this issue is personal for my family, as it is for so many Kentucky families. And so it's really happy to vote yes on Senate Bill 74 and to see both this and Senate Bill 61 pass out of committee. It's really a great culmination of the tremendous work that we did in 2019.
Thank you.
And Chairwoman Mosier?
Yes. Okay. All right. Senate Bill 74 passes with favorable expression. Same should pass on the House. Congratulations and thank you.
Thank you very much, Madam Chair. Thank you, members of the committee. I look forward to seeing a few of you here a little bit later on today.
Yes.
Representative Fleming, I just want to say if there's anything that your family needs, we have a lot of caregiver resources and support groups and various things that even virtually
I know.
can still help your parents.
Run and
so
get me something.
please, please feel free to reach out to the chapter.
I'm gonna wait till afterwards,
Anything we can do to help.
Thank you among the chatter.
Right. If you're online, if you're virtual, if you could please mute your device, that would be helpful. Thank you.
Madam Chair, I'd like to record some votes. If you've
Yes, thank you. I was going to ask if there are any members who need to record votes because I know that you're in and out.
If these have been done in order, I'd like to vote a yes on House Resolution 59, yes on Senate Bill 55, yes on Senate Bill 61.
Yes, thank you.
Those are the only ones you've heard so far?
Yes.
Okay.
And 154. Did you want to record a vote?
Yes, also on 154. Thank you.
Okay, thank you.
And then
Representative Rayburn.
I would like to record a vote for HR 59, a yes vote, Senate Bill 55, a yes vote, and Senate Bill 154, a yes vote.
Did you get that?
Almost all of them were yeses. Okay.
Okay.
Can I, Madam?
I didn't know who you were. I'm sorry. I'm getting these
Yes.
faces.
Right. Representative Prunty.
Prunty?
Yes on HR 59, yes on SB 55, and yes on 154, Senate Bill 154.
Thank you.
Was I here for 61?
We did hear 61.
Okay.
You want also? Okay.
Representative Weber.
I would like to record yes votes on Resolution 59, Senate Bill 55, Senate Bill 61, and Senate Bill 154. Thank you.
And Wilner online.
Representative Wilner, did you need to record a vote?
Yes, thank you. I'd like to record yes votes on Senate Bill 55 and yes on Senate Bill 154. And I think I got the other ones.
Okay. All right.
Thank you.
Next, we have Senator Carroll here to discuss Senate Bill 148. Please introduce yourself for the record and your guest and proceed.
My name is Danny Carroll. I'm the state senator from the 2nd District.
Shannon Smith, State Director of the American Heart Association.
Jennifer, you want to go ahead and introduce yourself also, please?
Yes, Jennifer Washburn, Executive Director of ICU's Childhood Enrichment Center in Marshall County, Kentucky.
And I love her t-shirt. Madam Chair, members of the committee, it's an honor to be here today to present this important bill. I know there are a lot of folks within our Commonwealth that are very interested in this bill, from child care providers to parents, and probably even a few kids throughout the state. As you all are aware, we have struggled through the pandemic with child care and the restrictions placed on centers. And as a result of that, we have lost many centers throughout the state, and others are struggling to survive today. And in this bill, Senate Bill 148, the primary premise of this bill is that it will restore child care numbers to what they were prior to the pandemic on February 1st, 2020. And it will also restore child care centers' ability to combine classes in the morning and in the afternoon. The bill also directs the Cabinet to promulgate regulations to identify emergency care providers who provide essential child care services during a state of emergency. This is something that the Cabinet has already been working on, and I know there have been several comments about this part of the bill. I have a draft of the regulation that they are providing, and you all know there was controversy about the limited duration centers that were assigned throughout the state. What I'm seeing through this regulation that they are, and this is a draft, I want to be clear on that, is that certified and licensed centers will be given preference in this process, and it will be done on an emergency to emergency basis. So if emergency comes up, then a licensed certified center could apply to be a center, an emergency care center. They would be able to do that a certain number of days before that certification is actually approved. And then it would also give the ability, say, should a tornado come through an area and wipe out an entire area and there are no centers standing, it would give the ability for a new provider to step in and be certified as an emergency care center. So what I've seen of this, I think, is fair to those existing licensed and certified centers. But again, this is a draft, and I want to thank the Cabinet, Dr. Vanover, for cooperating and trying to work together on these issues. I very much appreciate that. And Madam Chair, the final sections of the bill deal with family child care homes. In this bill, it states that the local governments shall not follow or pass ordinances or regulations pertaining to the certifications, licensure, or training requirements related to the operation of family child care homes. And in return, it also clarifies that family child care homes are not exempt from compliance with local government's ordinances and regulations that apply generally within the jurisdiction. And Madam Chair, next, there is language in the bill that designates child care as essential businesses. And I think, if nothing else, through this pandemic, we have learned exactly how important child care is to so many different fragments of our economy, of our society, of the functioning of this Commonwealth. And it does denote child care as essential. And in following through with that, it states by January 1st, 2022, a local government that has adopted zoning regulations within their jurisdiction, and that's Chapter 100 within statutes, shall specifically name family child care homes in the text of zoning regulations to authorize separate consideration of the applications of family child care homes for conditional use permits. What this means is, in a residential area, when a business wants to go in and operate in a residential area, they have to file a permit for a conditional use. And oftentimes within these cities, counties, they will be denied simply because it is a business. And this bill will require those local governments to consider a child care home for what it is and the essential nature of what it is in making that decision. So we feel like that this will help with some of the child care deserts in our state, that will facilitate, make it easier for many folks to open up family child care homes, which will help provide additional services that are badly needed throughout our Commonwealth. And with that being said, Madam Chair, I will turn it over to Shannon Smith with the American Heart Association.
Well, thank you for having us, and thank you to Senator Carroll. As you can see, that's why I was really hoping he was going to show up. He articulates this issue incredibly well. So I don't have anything to add to that other than to point out that, this is critical legislation to pass, because childcare is critical to all families in Kentucky. And we know that at least 14% of parents lost their job, quit their job, or had to stay home to take care of their children under the age of 6. So opening this back up, combining those classrooms, creating opportunity for rural America or rural Kentucky to have access to these in-home providers is critical. And we have a provider with us, and I'd like to give her a moment to talk. Hi, Jennifer.
Hi. Again, thank you so much for giving our voice the opportunity to be heard today. My name is Jennifer Washburn. I'm the Executive Director of iKids Childhood Enrichment Center here in far western Kentucky in Marshall County. We are a NAEYC accredited center. We're accredited by the National Association for the Education of Young Children. We are one of only 86 nationally accredited centers, early childhood providers here in the state of Kentucky. And what I wanted to just take a minute to share with you is how the restrictions as they currently are written have affected childcare within our state. We have lost to date 180 licensed and certified homes within the state of Kentucky, and that's just from March of 2020 till now. That's 180 facilities that are no longer operating for our children and families. We also have 144 centers that's both certified and licensed that are temporarily closed. They're not reopened yet. And in my center alone, last year, I lost $150,000 in order to try to do all that we can to fight the COVID and to work through and work with the restrictions as they stand. For me, the really hard part is the part at this point about combining in the morning and the afternoon. As a nationally accredited center, my ratios are, by my choice, lower than what the state recommends. So we currently, and we have always operated with a lower capacity. In operating with that lower capacity, it is important to us as a business model to be able to stagger employees as they come in throughout the day and as they leave in the afternoon. In order to meet the restrictions as mandated by the executive orders, we have to have our staff here from open to close. Well, I say open to close because previously our open to close was 6 a.m. to 6 p.m. In order to try to save a little bit, or not even save, in order to try to be operational, we had to adjust our operating hours. So we accept children at 6:30 in the morning, and then children have to leave by 5. And what that's meant for our families is that they too have had to adjust their working hours in order to accommodate our need to have lower operating times for them. We need assistance. The only reason that I am still here, and I am very thankful, is from the stipends that we have received from the state. That's going to run out. And it's going to run out very soon. And so we need to have the opportunity for that combining beginning and end of the day here so that we can get back to serving our parents and serving our families as we have done so well for the past over 20 years here in Western Kentucky. I know this isn't something that I'm the only one working through and dealing with here. I am licensed for 97 children. Currently, we care for about 67. We have a classroom that we cannot open that would normally serve 10 children, and we simply can't open it because I cannot afford the staff during the working hours that we are required so that we can maintain cohorting. And again, those 10 additional families that are unable to be served simply because we can't open that space because we can't afford to.
Motion on the bill.
Okay, we have a motion and a second on the bill. I just want to thank you both, all three of you actually, for being here today. Thank you, Senator Carroll, for your really hard work on this. I know that you've spent a great deal of time working with the cabinet and working with our wonderful providers. I've been part of some of those conversations and certainly have heard from many of my constituents and child care centers around the state during the pandemic. I think that the pandemic has really highlighted a lot of the needs, and when we think about 180 centers having closed, who are no longer you're no longer available as a support for children and families, but you're also small businesses. And to your point, Jennifer, I don't know many folks who could absorb the kind of losses that you all have had to deal with this year. And certainly as at a time when we talk about family supports, our licensed and our accredited child care centers are really those critical partners for getting our families back to work. And also when we talk about early childhood learning, these facilities are licensed and accredited and are developmentally appropriate and doing great work in this space. So I think that we need to keep all of that in mind when we consider the needs of our child care center. So thank you very much for your work. I look forward to this passing. We have a question or a comment from Representative Dotson. Wait, where are you? Oh, there you are.
Thank you, Madam Chair. My wife and I, we currently have owned a daycare there in Winchester, Kentucky for the last 20 years. So we too have made so many adjustments. We've lost about $180,000 to $200,000 this year as well. Just trying to juggle things around, make things as best we could. If it hadn't been for the stipend and the PPP money that we were able to receive, we would have folded. But I just want to reiterate and concur with what has been said here. Now, the question I have is that we received notice that March the 15th that we can go back to full capacity. Is that correct?
I don't know that it hasn't. I think it was if there were no spike in cases. So gotcha. I think it was provisional.
Gotcha.
And there is an emergency clause on this bill. So either the governor signs it, or after 10 days, if he doesn't sign it, it goes into effect at that point.
Okay. Thank you. This is a much needed bill.
I would just add that this bill also addresses the combining of classroom sizes, and it also addresses the in-home and the essential workers. So there's really three critical pieces that is needed in this legislation.
Okay. Thank you.
Okay. Representative Weber.
I want to thank all three of you for being here today. Shannon, it's always good to see you. Jennifer, I appreciate your comments and your story. Senator Carroll, you and I have served together in several capacities down here, and I've enjoyed every bit of it. I want to thank you, and I'm going to commend you publicly right now for bringing this. One of the things that has burned me up over the past year has been an industry that was vital to this state was abused and treated in a terrible way. And Shannon, you cite 14% of families. I've heard from a lot of those families. I'm surprised it's not more than 14%.
That's what we've been able to identify.
Yeah, I don't doubt
I'd
you.
say it's higher too.
I don't doubt the 14, but still at 14%, that is so high. And I've heard from families who were in situations where they were forced with either, do I keep my job or do I stay home because I don't have child care to provide? And many families have had to make adjustments. I've talked to families that have lost their homes, and they're living with relatives now. So I appreciate you bringing this forward. I hope we never go through this again. And I think we need to leave today with one thing in mind. that truly over the last year, we have seen the child care industry in this state has been decimated. And it didn't have to be that way. So I'm going to vote for this bill, and I appreciate you, Senator, doing it. I miss you on the Economic Development Committee. It's in good hands now, but I do miss our work there. And Shannon and Jennifer, I appreciate you all being here today. Thank you.
Thank you, Representative.
Thank you.
Okay. All right. Thank you. Seeing no further questions, Secretary, please take the roll.
Representative Bentley?
Yes.
Representative Bowling?
Yes.
Thank you. Representative Bray? Representative Birch? Representative Dotson?
Yes.
Representative Elliott? Representative Fleming? Representative Frazier?
Yes.
Representative Marzian? Representative Gibbons-Prunty?
Yes.
Representative Rayborn?
Yes.
Representative Raymond?
I vote yes for the 100,000 plus Kentucky moms who've had to leave their jobs and for my 1-year-old who's trapped in the baby room at her school.
Okay. Representative Riley? Representative Sharp?
Yes.
Representative Sheldon?
Yes, and I would just like to say I have no idea why it took till today for seems like everybody to figure out how essential. And I know a lot of folks knew, but unfortunately the right ones didn't. So I am so thankful for this bill, and thank you, Senator Carroll, and everybody else.
Representative Tate? Yes. Representative Weber?
Yes.
Representative Westrom? Representative Wilner?
Sorry, yes.
Thank you. And Chairwoman Mosier?
Yes.
Yes.
Okay.
You all got to get a consent agenda again.
I wish we had that. Senate Bill 148 passes with favorable expression. Thank you very much again for all of your work.
Thank you, Madam Chair and members. Very grateful.
Okay. See no further